Desert Oasis Healthcare believes knowledge is power. And so we started a series of educational videos to really make sure you all feel informed and empowered about whatever the topic might be in the healthcare world. And today we're talking all about wellness and prevention. And so we're bringing in Leah Dixon, the Senior Director of Wellness and Priority Care. Leah, I think it's so important to talk about prevention. I think oftentimes when people think of healthcare in the medical world, they think, I'm sick, I go see my doctor. But the whole point of the wellness clinic and preventative care in general is try to avoid getting sick in the first place, right? Talk to us about preventative care.
So really preventive care is just about identifying these chronic conditions that may not have been previously identified at like a primary care physician's office, or just something, maybe the patient has not been engaged. Maybe the patient has been in the community but is not engaged with the primary care physician. We want them to come into the wellness clinic because we want to identify these issues. Are they living alone? Do they need a referral over to social services? Is there a new diagnosis that needs to be addressed? And it's really all about identifying these chronic conditions in these patients and getting them plugged into the resources that we have here at Desert Oasis Healthcare, because our goal is ultimately to keep patients well and to keep them out of the hospital. And that really is the whole goal of prevention, is keeping our patients well.
And you say identifying these conditions before, right? Before they ... whatever that is, become increasingly dangerous to their health, right?
Correct.
Why did DOHC create the wellness clinic? It was many years ago, right?
So the goal is really to help the primary care physicians. We function as an extension of the primary care physician office. And one of the things that we want to do is we want to help improve the primary care physician's access. A lot of times patients can find it difficult to get in with their primary care physician if they have an acute new issue that needs some sudden attention from their primary care physician. So really the idea is just really to function as an extension of the primary care physician and to just work in conjunction with them to help them manage their patients.
So when people see their primary care doctor, hopefully at least once a year, maybe twice a year, the wellness clinic steps in to kind of fill that time in between the doctor's visits to make sure you're still being checked out and cared for, right?
Correct. And to make sure that there's no new changes, there's nothing new in the chronic condition, there's nothing new that has come up that needs to be addressed. Yeah.
So walk me through, if Mrs. Smith walks into the wellness clinic, she has an appointment, what's her visit going to look like?
Well, her visit is going to be an hour total. The first 30 minutes is with the medical assistant, where she will get a series of tests done. We will screen for depression, memory. She'll get an EKG. If she qualifies, there's this tool that we can use. It involves a blood pressure cuff and an EKG lead to help identify any patients who may have asymptomatic stage B heart failure. So we ask a series of questions, and that information is then handed over to the physician assistant or the nurse practitioner. And then the second part of the visit, the second 30 minutes, is with the provider, the NP or the PA. And that's where they go over all of the results from any blood work that was done, the EKG results, so forth and so on. And that's where the patient really gets a lot of education, and we will refer to our internal programs here at Desert Oasis Healthcare as needed.
I think it's really important to point out, because I know a lot of people love their primary care doctor, and I've heard people say, oh, I don't want to go to the wellness clinic. I love Dr. Jardula, or I love Dr. Corzano. It's not replacing your doctor.
Not at all.
They're working together, so whatever comes of your wellness clinic visit, that will be relayed to your doctor, right?
Yes, that is 100%.
Explain that process.
So that is 100% correct. So generally within 24 hours of the wellness clinic visit, everything that happens in the wellness clinic, all of the tests, the EKG, the note itself, is all transmitted over to the primary care physician's office electronically. So we do that very timely. We do believe that it is important to get this information in front of the primary care physician in a timely fashion. And you are 100% correct. We do not take the place of the primary.
So walk people through the process too. Do they call to get scheduled, or the team really calls them to check in as well, right?
We have a whole team that is just dedicated solely to reaching out to these patients. But we do have those patients that like to come and see us, and they will call year over year. We even work with the primary care physicians' offices. Oftentimes I guess this is kind of like a relatively new concept. The primary care physician's office will actually book the appointment for the patient. So then the primary care physician is telling Mrs. Smith when her appointment is.
And I know sometimes there's obstacles, or people feel like there are obstacles. For example, if somebody doesn't have a car, they live in an area that's a little bit remote, what do they do to get seen?
Well, one of the things that COVID taught us is that we can do things virtually. And so what we will do is we have a team of people that will take a tablet if needed. So it's just a, an iPad or something where this device is taken to the patient's home. We want to meet the patient right where they're at. We want to make this accessible to all of our patients. So this tablet is taken to the patient's home, and then they are connected virtually back to one of the providers in the clinic.
And this is a free service.
This is a free service to all of our members, our senior members.
Right. We started talking about this prevention and wellness. To bring it full circle, again, just highlight for us, Leah, why it's so important to take care of yourself before you're sick.
Well, one of the things I think that is just important to people in general, I know that this is important to me, is just maintaining the quality of life and health as we continue to age. I know that as I age, I want to continue doing the things that I enjoy. I have family members. I want to spend time going on vacation. My husband loves to golf. And so I know that if these things are important to me, these are also going to be important to other people as well. So just really helping our patients to continue with their quality of life so that they're able to enjoy the time that they have here, that they can enjoy this beautiful weather that we have here in Palm Springs. They can enjoy their relationships, their communities, so forth and so on.
I understand another part of the wellness clinic is helping people with life planning if they have those questions.
That is correct. So I will just add this is just my own personal motivation. My father got sick several years ago, and it was really unfortunate throughout the progression of his illness. Nobody sat down and had a conversation with him about, what's going to happen next. And one of the things that is important to Desert Oasis Healthcare, and we've also implemented this into our wellness clinic, is what we call life planning. So it is, what do you want to happen? And this isn't a question about, how does someone want to die? This is about how do you want to live? And so I think that these conversations are very important to have. So in our wellness clinics, we have a team of people that are just dedicated to helping patients understand these documents. They can be very cumbersome. They can be very confusing. They require notarization, signatures of physicians or NPs and PAs. And we just have a process that is very fine-tuned, along with staff that can help support these conversations and get the required signatures needed to make these documents legal so that what a patient wants is in writing.
And this is very special that DOHC is combining and offering to people not only medical care, but prevention, even life planning. I mean, that sounds very unique to the system.
It is very unique to the system. Years ago, I actually attended a conference, and whenever I was at this conference, and really just any conference in general where people are talking about innovative things, what we need to do next, and all that sort of stuff, Desert Oasis Healthcare is generally ahead of the curve on a lot of the innovative concepts that are going on out there in healthcare. And I can tell you that we are ahead of the curve also when it comes to these life planning concepts. Not everybody does these life planning conversations or have these life planning conversations with their patients when they're well, when it is important to have these conversations with their patients. And I know that Desert Oasis Healthcare, in my opinion, has just really set the bar when it comes to that. I know that maybe not everyone does this.
So I know the wellness clinic schedulers are on it, calling everybody, but if somebody wants to be proactive, how do they get a hold of the wellness clinic to make their appointment?
We have a phone line that is dedicated to appointments. I can give you the number now, 760-969-6536. And then you can also walk into the Palm Springs campus and make an appointment. And we have 5 locations. We have one in Palm Springs, Bermuda Dunes, Indio, Yucca Valley, and Coachella. We added the Coachella office last year.
Wonderful to be able to service the East Valley.
Correct.
And the wellness clinic is just one added layer of protection.
Correct.
To make sure that you are staying your healthiest self.
Yes.
Thank you, Leah.
Thank you.